Good morning. I am Bob Ponce here for Harlem Emergency Network. I am usually here with Carol Johnson, but Carol Johnson has the morning off. And after we've done about 70 of these broadcasts weekly, and Carol hasn't missed one. And so she's given the day off. But I am going to be joined by my brother Mark McPhee, also of Harlem Emergency Network. Looks like he's coming in right about now. Okay, Mark, let's see. Okay. All right, well, Mark is going to be coming in. Mark, I think you need to turn your camera on. Meanwhile, I am going to get started with this broadcast and he will join us shortly. So, wanted to talk a little bit about the COVID 19 update and how it relates to going back to school. So, as it looks like this year, we're not looking at remote school, they're looking at having students back in school. And there's been a little bit of discrepancy in terms of the advice, in terms of how it should go. According to the CDC, they have come up with standards to say that vaccinated kids do not need to be masked, but everybody should do social distancing, at least 3 feet of physical distance between students and in classrooms. And people who are not fully vaccinated are should be wearing masks. Now, the American Academy of Pediatrics is asking for a more stringent standard. They're saying that all school staff and students over 2 years old should be wearing masks when they return to school this fall, regardless of their vaccination status. And so I think this is based on looking at the data from last year and looking at what's going on with the variants that that American Academy of Pediatrics is definitely looking for more stringent standards. So, as makes sense, I'm sure many parents are really concerned about, what are they sending their kids into, and what are the things they can do to basically make sure that their kids are as safe as possible. Um, so I've got an article from some doctors, Dr. Jesse Pelletier and Terrence O'Brien. And one of the things they're talking about that can add to the protection in school is a simple practice that we all know about, and it's gargling. And so they're recommending that we look into gargling as a way to basically cut down the viral load so that if there's a spread of COVID in the schools, this is something that kids can do and adults can do as well that will cut down the spread. So, what they're saying, and this is a quote from an article in MedPage today. One underexplored strategy to better control transmission of SARS-CoV-2 in schools may involve the use of a dilute oral antiseptic gargle or oral rinse. Um, Listerine for those uh, keeping track at home. Similar to the two-way protection afforded by masks, treating the mouth with a safe, effective dilute antiseptic can better protect students by reducing spread and preventing infection. The idea is simple. If a child is asymptomatically infected and shedding virus, a before and after school oral treatment can potentially diminish the quantity or quality of active virus entering infectious droplets, making them less infectious. And on the other hand, if a child is healthy but exposed to the virus, the treatment might provide protection against or at least mitigate infection. And so there's a lot of research that has supported this. I mean, gargles have been going back thousands of years. The ancient Romans did it, the Egyptians did it, the Chinese did it. They probably got it from the Africans. Um, Modern gargle science, especially with the use of alcohols, has been proven. There's a lot of data behind it. There's also some data that came out last year suggesting that, and I mentioned Listerine because I saw an article talking about Listerine and its effectiveness against COVID-19. So I'm not paid to say that. I wish I was. But the fact is, I want to give you guys practical solutions to use, and that's a practical solution that you can use to protect your kid. Um, the other thing that's going on right now, as a result of the spread of the Delta virus, is that there's more pressure on groups to make vaccination mandatory for certain workers. So, the American Medical Association, American Nurses Association, and there are 55 other organizations that are joining the chorus supporting mandatory vaccination for healthcare workers. Um, the president of the AMA, Susan R. Bailey, said it is critical that all people in the healthcare workforce get vaccinated against COVID-19 for the safety of our patients and our colleagues. Increased vaccination among healthcare personnel will not only reduce the spread of COVID-19, but also reduce the harmful toll the virus is taking within the healthcare workforce that we are striving to serve. So, as you can see, the push is on. There's also some pressure now to make it a mandatory for city workers, and in particular, they're looking at the police force, which has a very, very low rate of vaccination. And the concern is that the police force being out and about and interacting with the public, create a danger not only to themselves, but to other people. And the fact is that the number one loss of life for policemen in the line of duty in 2020 was COVID. So there is some common sense there to talk about that. So we will keep your eyes on the development as there's more and more push, both nationally and internationally, to make vaccination mandatory in certain situations, whether it be job situations or whether it be events that you can go to. And so, in particular, there's an event that's been planned coming up here in New York City called the Homecoming Concert. And so this is a concert that is supposed to occur on the Great Lawn in Central Park on August 21st. It's a We Love New York City. New York City is back homecoming concert that's been coordinated by the mayor's office and Clive Davis, the music industry impresario, Danny Meyer, the restaurateur, and they coordinated with Live Nation to come up with this lineup. And so the lineup of artists includes John Baptiste, Andrea Bocelli, Kane Brown, LL Cool J, Elvis Costello, Lucky Day, Earth, Wind and Fire, Babyface, Cynthia Erivo, Jimmy Fallon, Jennifer Hudson, Wyclef Jean, Journey, The Killers, Don Lemon, Barry Manilow, the New York Philharmonic, Polo G, Carlos Santana, Paul Simon, Patti Smith, Bruce Springsteen, and Rob Thomas. And this lineup has gotten some flack from younger people who say that, while I forgot to mention the key to this concert is you have to be vaccinated in order to go to the concert. So again, they're trying to, I guess, incentivize people to be vaccinated by creating a concert that only vaccinated people can go, and you've got to have a ticket and proof of vaccination. 80% of the tickets will be free. There will be some VIP tickets available for purchase. Now, the flack that they're getting is that as you heard the lineup that I just ran down, there's not a lot of acts that are really targeted toward young people right there. I mean, you got Bruce Springsteen and Elvis Costello, Earth, Wind, and Fire. A lot of artists I love, but I can't say that right now when the push to get more young people vaccinated, and you're trying to have a concert to incentivize people, and then there is no one on that lineup that is really going to appeal to anybody under the age of 30 or maybe even 40. So that's just keeping you in touch with what's going on. Um, and so the rest of it, you kind of know, the Delta um, variation is still, uh, very, very strong, in the city, in the country, in the world. And that's driving a lot of concern over it. And so you're hearing some of the messaging change a little bit as well. And so I think there's an acknowledgement, more of an acknowledgement now that masks are still a necessary precaution that people need to be taking, even if you've been vaccinated. There's an acknowledgement that even with fully vaccination, you can still get COVID, but you're not likely to get a serious version of it, and you're not likely to be hospitalized or die from it. This is based on the data from the millions of vaccinations that have been done so far. But somebody who has been vaccinated can still spread it to someone else. It's less likely, but it's still something that's possible. And so now we see the CDC backing off from where they were at, say, a month ago, when they're saying that if you're vaccinated, no one has to worry about wearing masks. Many doctors at the time thought that was they were, let's just say they were off message on that. And then I think they're coming back in line with what many people were thinking, is that it would have made sense to keep precautions in place, a little while longer, because what we've seen is that the virus goes going down, 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 and then it's dipped up again. And so we have to continue to do all the protocols we talked about, which is washing your hands. This morning we mentioned gargling. I definitely recommend that you not only put that into your repertoire, but definitely get your kids into it. You're sending your kids into school, have them rinse their mouth out, you know, before and after school. These are good practices in general. It'll probably cut down on other things such as flus and colds, but you definitely want to cut down on anything that can limit your exposure to COVID. So that's what's going on. We were supposed to have my brother Mark McPhee on. I know he's listening. We're gonna work out the technical difficulties next time, and we're gonna have you on next week. Those of you who know, okay, he's trying one more time. I'm not sure what's going on with the camera, but we're gonna work it out. If we don't work it out this morning, we're gonna have you on for the next one. Mark is a valued member of a Harlem Emergency Network, and we're continuing to make sure that you've got the information you need to protect yourself, not just from COVID, but from any emergency situation. And remember, protection from COVID starts with your mindset. It starts, it's not the mask, it's not the vaccine, it's your mindset about taking ownership of your own health. And that means doing the things you need to do to stay healthy and safe. And so that includes doing the things necessary to boost your immune system so that when you come into contact with a virus or a bacteria, your body was engineered to handle viruses and bacteria on a regular basis. And when you get your body out of balance, which most of us are because of the lifestyles and life we live on the modern era, the food sources we have, the things that we're eating that don't contribute to our health and well-being, that leaves an opportunity for these microorganisms to play a negative role in our health profile. And the best defense is to take not a one stop approach. The vaccine is one tool. Using masks is one tool. Washing your hands is one tool. Boosting your immune system is another tool. You don't want one tool, you want all tools. And so we continue to recommend that you stay safe, um, look out for each other, share this information. So I'm going to recap what we talked about this morning. Um, August is prepare back to school month. If you have kids, remember that kids under the age of 12 are not able to get vaccinated at this point in time. Kids from 12 on up have an opportunity to get vaccinated, but that vaccination rate is still climbing, we'll say. So if you are sending your kids to school, you make sure that they stay masked up. We recommend that you institute gargling with an antiseptic rinse. I mentioned Listerine. I'm sure there are others, but I know that Listerine, I've seen some evidence that it's effective against COVID. So, um, you know, take care of yourself. Make sure you got those kids into the habit of washing their hands, not only um, when they come in, when they leave, but get them into washing their hands at the school. Get them into using hand sanitizer. Get them into using some sort of liquid ring. You can get those small bottles of Listerine, those travel bottles, and put it into your kid's thing, and just say, look, run into the bathroom, rinse your mouth out a couple of times a day. Get them into a habit. Figure out how to incentivize them to do it. These are small things, but these are the things that will keep you and your family safe. And just use a higher level of common sense. So that's all I have for you this morning. We're going to be back again next week. I'm sure Carol Johnson will be back. Mark McPhee is going to be here. And Harlem Emergency Network will continue to be here giving you the information you need to do to keep yourself safe from COVID-19 and other emergency situations. So thanks for listening, and we'll see you next week.